Russia registered the world's first vaccine for COVID-19, Sputnik V. It was initially met with skepticism both abroad and at home. Fears were later put aside by, well, months of successful use all over the world and multiple publications in science journals. So now, another institute aims at another record, and that is registering the world's first effective medication for COVID-19. The drug, called MIR-19, is still in the early stages of testing. It's almost past phase 2 clinical trials, but has already managed to drastically reduce COVID-19 levels in test subjects.
The medication targets a certain part of the SARS-CoV-2 genome, which then undergoes certain modifications and is finally eliminated. So this medication effectively prevents this virus from replicating. The preclinical trials we carried out showed that MIR-19 decreases the virus's reproductive ability by 10,000 times.
The drug is about to undergo the most critical part of its testing on a large number of volunteers. The way MIR-19 is supposed to be administered will be familiar to anybody who's suffering from asthma, for example, through an inhaler just like this one, because apparently it's the most effective way of targeting the virus.
This infection enters the body through the upper respiratory tract, so we have to block this gateway for the virus. Our testing proved that this method is more effective than others in tackling the virus.
I'm told that the main challenge that scientists faced here was to make the drug target only the genetic material of the virus and not of the human host.
When developing a medication that is based on two components, it's important to make sure that one of them doesn't prevent human genomes from functioning properly. Our medication only blocks the virus's genome. We carried out a thorough analysis that has proven the safety of the medication. The first stage of clinical trials shows that it poses no threat to healthy individuals. Today we are at the second stage of clinical trials, which involves people infected with COVID-19. Our previous results reassure us that it will not cause any side effects. We hope that ultimately it will be allowed for use in people from all age groups, starting from the elderly to children.
If MIR-19 proves its safety and efficiency, it could be a game-changer in ending the pandemic. And amid fears of another wave of infections looming, the medication is eagerly awaited not only here in Russia, but Japan and South Korea have also apparently shown an interest in the drug.